Today, I'll talk about endoscopy simulator and hands-on training. Topics of my presentation will include various issues of simulator training and ESD learning. First topic is endoscopy training with simulators. Traditional endoscopy training means observation and do-it-yourself. New style endoscopy learning starts with box simulator trainings followed by description exercise. What is box sim? Box simulator training. In the year 2005, I found a box simulator in the Olympus Company booth. I bought the simulator immediately and started box sim training at my center. What kind of simulator is the best for the beginners? Do you think the computer simulator is better? No. Box simulator is much more useful for the endoscopy beginners. We are using the Olympus endoscopy system at SMC Clinical Simulation Center. We also use the Fujifilm systems at the simulation room in the endoscopy unit. For the boxing workshops, we mostly use the rental endoscopes from Pentax, which is a brand new system. For the biopsy training, homemade simulator box and basket are used. We are running the regular boxing workshop, usually twice a month. During the KinCA 2019 masterclass, we had a special boxing training for foreign surgeons. We also support boxing training at local hospitals. I performed 12 boxing workshops outside my hospital for the last 8 months. I recently started teaching the medical students. To my surprise, they learned the endoscopy skills very quickly. I think it's because they are young and flexible. For the endoscopy learning, the younger is the better. This is a typical program for boxing workshop. There are 3 short lectures and 2 hours of hands-on training and 1 hour of self-training. Of course, colonoscopy boxing is available at my institution. Next topic is description exercise workshop. I recommend to describe following the SMC style, which means location, size, major finding, minor finding, impression, and classification. Description exercise workshop is a very interactive course. Final topic is ESD educations. There are 4 must-knows before starting ESD. Indications and skills for careful endoscopic evaluation for candidate lesions. Advantages and disadvantages of each instrument. Strategies for technically successful ESD. How to manage complications. And hands-on training must be side by side. Endoscopes and knives. These days I have used a new endoscopy system called Imagina from Pentax for gastric ESD. Imagina endoscopes have many advantages such as brighter image, water jet function, lightweight, but as a therapeutic endoscopist, better close-up view and more angulation is the most attractive aspect. This is a recent ESD procedure using Pentax Imagina endoscopes. Indigo carmine spray, marking, circumferential cutting, submucosal dissection, final resected specimen. The whole procedure in one image. Close-up view of the resected specimen. There are 2 tumor lesions in one specimen. The pathology. There were 2 small early gastric cancers in one single resected specimen. Recently, we are also using Korean ESD knives. Some of them have water jet functions. This is my recent favorite ESD knife from a Korean company named FineMedics. It has IT knife-like function and dual knife-like function at the same time. This case shows how I use the H-type ESD knife. At first, I start with the I-type tip for marking and circumferential cutting, and then I change into O-type knife for speedy submucosal dissection. I think it can make the procedure quite short. Due to the time limitation, it is difficult to talk a lot about the technical aspect of ESD. This is how I do the circumferential pre-cutting with needle-type knife. Left side first, right side second. Finally, horizontal cutting of the proximal part. Location also matters. In this case, en face view of the lesion is easy, but close-up view was difficult. So a large loop approach was used like this cartoon. Traction method is also very useful for lesions at a difficult location. In my opinion, the ESD training should be stepwise. Stepwise ESD training at Samsung Medical Center starts with basic training with ESD bags and ESD brushes. Next step is endoscopy ESD. ex vivo pig stomach ESD, live pig stomach ESD, and finally the real clinical case ESD. Movement of ESD knife is mostly circular and horizontal. For the training of knife control in the circular and horizontal direction, I developed some training modules. ESD bags for circular training, ESD brushes for horizontal training. This is the ESD bag for circular training. Circular movement training with biopsy forceps on the ESD bag. This is the ESD brush. I'm trying horizontal movement training with biopsy forceps on the ESD knife. This is the artificial layer endogel. Artificial layer endogel is a good alternative of ex vivo pig stomach. It was originally released in a paper box. But we are using the endogel with Kogan gastroscopy simulator because it is more realistic. I recently made a docking station or a platform for endogel ESD in the Kogan simulator. In the endogel ESD, hands-on traction method is usually needed due to the mucosa is not real. We are using Pentax Splash M knife for the endogel ESD hands-on training. Splash M knife is a new multifunctional ESD knife from Pentax company. It has a needle-type tip with hooking mechanism. At the distal end of the knife, there is a metal plate which is useful for bleeding control even in retracted position. The length of ESD needle is 2 mm in extended position and 0.5 mm in retracted position. In my recent experience with the Splash M knife, I found 3 advantages. First, the hooking mechanism is very useful for the submucosal dissection step. When a lesion is located at difficult location and the approach is not easy, I usually used the dual knife and IT2 knife for a patient. But the Splash M knife, I can do the procedure without using the IT2 knife. Second, the metal plate at the distal end of the Splash M knife provides enough contact area for the bleeding control during the procedure. Finally, the procedure time is much saved due to the waterjet function. In a recent study from Japan, ESD using Splash M knife appears to reduce the usage of hemostatic forceps during the gastric ESD without increasing the adverse effect. It can reduce the total cost of the treatment. This is my recent case of ESD using Splash M knife. I didn't use hemostatic forceps in this case. This is endogel ESD using needle time knife and traction method. I made a marking with name pen. Circular cutting in the left hand side. Circular cutting in the right hand side, and then horizontal cutting. Partial submucosal dissection. This is a traction instrument. Traction ESD is tried using the instrument. Almost done. Final cutting. Resected specimen. For the beginners, hands-on training using an ex vivo pig stomach is very useful. Ex vivo pig stomach ESD should be done in a special facility such as the animal lab, so it is very difficult and expensive to do ex vivo pig stomach ESD workshop, so we don't do it often. The best and the last option for ESD training before the real clinical case is live pig ESD hands-on training. We are regularly doing live pig ESD hands-on workshops at Songdo, Incheon. Before starting ESD for the first time, beginners should have some experience as the first assistant. With some cases, the main operator usually gives the beginners to do part of the ESD steps. This ESD is the first procedure of my young fellow. Telementoring using iPhone FaceTime app is a very useful tool for ESD beginners. International mentoring is also possible. If you want some real-time comments from me, send me an email at stomachlee@gmail.com. For the foreign doctors, 1-week ESD training course is also available at Samsung Medical Center. It consists of introductory lectures, ESD observation, ESD conference, and ESD planning session, hands-on training using endogel or live pig. The tuition fee is $2,000. Ladies and gentlemen, I'd like to conclude my presentation by saying that diagnostic and therapeutic endoscopy simulators are very useful tools for the endoscopy beginners. ESD learning should be stepwise. Thank you very much for your attention.